The world has a 6-month window of opportunity to vaccinate Africa against COVID-19 before the next variant impacts the continent, according to a new research paper published by the Tony Blair Institute for Global Change. The Institute has identified a trend where roughly every 6 months, a new wave driven by a new variant impacts Africa. The damage caused by previous waves of infection underline the importance of government taking urgent action against future variants now. The paper also found that countries in Africa are approaching lockdowns more cautiously than before, recognizing that they are not always the best course of action to tackle COVID-19 due to their negative economic and social impacts. The main COVID-19 trends in Africa are populations with high levels of immunity either through vaccination or prior infection fared well against Omicron. Positive Omicron cases have had fewer hospital admissions and deaths. Countries' economic recovery is a setback by Omicron. There is roughly a 6-month window between COVID waves driven by new variants, a move away from blunt lockdowns as a response. Adam Bradshaw, senior COVID-19 advisor at the Tony Blair Institute for Global Change, said, quote, Omicron was like a flash flood. It did some serious damage, but thankfully it didn't lead to mass death. However, we may not be so lucky next time. The next variant may be more severe, especially in countries with low levels of protection in Africa. He continues, we now have a 6-month window of opportunity to meet the WHO target of vaccinating 70% of Africa and the rest of the world. No one is safe until the world has been vaccinated. We need global leadership to bring all organizations working on this together and to defy short-sighted nationalist politics. The paper recommends that African countries should prioritize the rollout of vaccines and boosters, increase testing and genomic sequencing to reduce transmission and keep society and the economy running. Recognize that as the virus is changing quickly and countries need to adapt, so lockdowns are not always the best course of action. There are a range of tools to consider first. The Tony Blair Institute is calling for global leadership to produce a global pandemic plan and support low and middle income countries in the global south to vaccinate their populations.